Health Ministry has issued an important clarification on booster doses in India. There will be no vaccine mixing. So all those individuals eligible to get their booster shot from the 10th of January will be administered the same vaccine that they were given the first 2 doses of. Vishnu joins us with the very latest. Vishnu, what more can you tell us?
So this is a very important development because remember on the 10th of January is when senior citizens with co-morbidities, in other words, those who are 60 years of age with co-morbidities and frontline workers or election commission officials, because you've got elections coming up as well, will be given what the government has been calling a precautionary dose. In simple language, it's a booster dose. Many of these individuals would have gotten their second dose of vaccine several months back, even perhaps 9-10 months back. So now the government has decided, and this is something which is a touch controversial, that the third dose will be of the same vaccine. In other words, if they've had a dose or 2 doses of Covishield, the third dose will be of Covishield. If you've had 2 doses of Covaxin, the third one will be of Covaxin as well. Whereas global practice and global studies around the world have indicated that mixing vaccines tends to lend itself to a more effective solution against Omicron. But this is the first announcement, as I understand it. Whether there would be subsequent announcements as well or not, that's something that we don't know right now. But if there are subsequent announcements, then the sense is that it's going to be something larger, perhaps for a larger population in this country as well. That means all adults. But at this stage, the government is going about this, in a very phased sort of manner, and that lends itself to lots of questions. Because a lot of people have said that the world around, boosters are being rolled out for everyone. Why do we have to have only doctors and frontline workers getting the first round of boosters? Why not roll it out for a larger population? And why not have a greater availability of vaccines, particularly since vaccines are available in India? For example, Covovax, manufactured by the Serum Institute of India, is believed to be an excellent third drug. It's already being exported by India to Indonesia and the Philippines, and I believe it's set to be exported to some European countries as well. This has been in stock now in India. It's got WHO clearance. It's got even emergency use authorization in India. So why has that not been rolled out? There is another vaccine, a very good Indian vaccine from all accounts, Corbevax, manufactured by Biological E. In fact, the government had already invested in this vaccine earlier on. They've already pre-placed orders. Why isn't that being rolled out in the onset itself? So these are questions which will be asked. But for the moment, it is good news because it's not bad that you have a third dose of Covishield by any means. Remember, 90% of India has had, whoever's been vaccinated have had Covishield, because there are studies which have originated from the United Kingdom which say that a third dose of Covishield is something that gives you an element of protection.
Vishnu, 2 quick questions here. AstraZeneca had released an important study about a fortnight ago where they talked about how a third dose of the AstraZeneca vaccine, which is Covishield for us here in India, will be more effective against the Omicron variant. There is, however, no data available at the moment on what 3 doses of Covaxin mean. Also, the dosing interval. We know that Covaxin initially was given as a 2-dose vaccine with doses, given 1 month apart. Covishield in India still 3 months apart.
So as far as the booster shot is concerned, it doesn't really matter. Those who have received 2 doses, and I think it would be approximately 6 months, but that's something the government needs to specify, 6 months or so from your last dose, at a time when your antibody count or your resistance against COVID starts declining. That's when this third dose would be prescribed. So along with the instructions would be a clear set of guidelines on who is eligible, in that entire group of above 60 with comorbidities. For example, if there is an individual who is above 60, then presumably you would need to have had your last dose a certain number of months back when there is seen to be waning effectiveness against COVID is concerned. So that date is going to be very important. That's something the government will need to work out. The second point that you mentioned over there is, yes, a couple of weeks back there was a study done, in fact, by AstraZeneca saying that a third dose of Covishield was going to work quite well. It would provide a reasonable amount of protection, but the exact amount, the effectiveness, percentage terms, that's still something that's not clear. A third dose of Covaxin, again, we don't have any data at this stage, but by all accounts, after its WHO clearance, Covaxin is seen to be an efficacious drug which has provided a reasonable amount of protection against Delta, and it is hoped it would do so against Omicron as well.